Explain what you mean by laparoscopically.
Laparoscopic is where you make tiny incisions across your belly, about 1 centimeter in size. Through one incision, we'll insert a camera, and that camera will give us an image on a screen. And based on that image on the screen, we're able to put in instruments through these other incisions and perform this entire operation.
In other words, you don't cut the person open.
You don't make that big incision like the traditional operations.
Right. How long does this operation take?
Typically takes about 2 hours.
Wow. And the difference between this and the lap band is that you're tying off the stomach completely, right?
Yeah. Over here what we do is we typically divide the stomach completely. We completely separate the upper portion of the stomach from the distal stomach. So you end up with a small gastric pouch. We also go further down and we reroute the small intestines in such a way that we're bypassing the old stomach and a very short segment of the intestine. So you end up with essentially rerouting the GI system to a certain extent. So food comes down the esophagus, fills this little pouch. As soon as this fills up, it stretches and it sends reflexes back to the brain saying that you're full. And the food eventually makes its way down. And the stomach, while it's still there, will produce acids, and you get some of the enzymes from the pancreas that comes down and meets up with your food bolus and therefore enables the digestion and the absorption to take place further down.
Which is a better way to permanently keep the weight off? Either way?
Either way seems to be working really well.
Right.
Okay? The data supports both procedures, and as far as which procedure is better, that typically is left up to the patient to decide on what they're comfortable with.
And how do they make that decision? I mean, one costs more than the other, I would assume.
Price might be a factor, but typically if you're going to undergo surgery, you do want the procedure that's best for you. And as far as how that's determined is really up to the patients. We describe both operations.
Right.
One operation where you lose weight a little slower than the other, which is the band, and you may lose a little less than the bypass.
I think it's important to point out that once a person undergoes a surgery, they don't immediately lose weight.
Right.
It's over a period of time, isn't it?
It's over a period of time.
Generally, that time is what?
For the bypass, you can lose up to 70 to 80% of your excess body weight in a period of about 1 year.
And that can be anywhere from 100 to 200 pounds.
Right, right, exactly. And with the band, it's typically about 50% over about a year or two.
After a patient leaves the surgery room, you follow up with them for a long period of time. How long a period of time?
For the rest of their lives.
Yes.
The patient typically, right after surgery, sees me in the office 1 week after surgery. By the way, I must mention that they're typically in the hospital for 1 or 2 days.
Yes. That's
and
all.
Then that's it. And then they go home, and a week later they follow up with me. A month, then they follow up a month after surgery, then 3 months after surgery, 6 months after surgery, 9 months after surgery, 1 year after surgery, then every 6 months after that for the rest of their lives.
And they just continue to lose weight.
They continue to lose weight for up to a year, year and a half.
Okay.
After that, it pretty much stabilizes.
I see, this is a big solution to the obesity problem in America.
Right.
It's just a matter of getting it maybe the right price or something like that, where people can, are insurance companies using this as an opportunity to reduce some of their overall later on problems with medical costs?
A lot of insurance companies are opening up to the idea.
Yes.
And a lot of them are still yet to be informed in terms of research evidence. And as you know, we practice evidence-based medicine, and so they're looking for a lot of that. And I think they're opening their eyes, they're seeing a lot more of that, and the benefits of actually having the operation as opposed to having to pay for the medications for diabetes, for hypertension, for hypercholesterolemia, etc. And they are opening up to this idea. They're actually paying for it. There's still some insurance companies and some other IPAs that eventually will open up to this idea after they get a little bit more information on these various procedures and how they actually transform these lives.
Right. After you lose the weight, there's some other medical benefits that a person becomes available to them, like less diabetes, correct?
Right.
What are some of the other things? Lower blood pressure?
The blood pressure, I've seen patients actually walk out of the hospital completely off of their diabetic medications,
Really?
completely off of their blood pressure medications. Their sleep apnea over a month or so essentially completely goes away. their gastroesophageal reflux disease, which is severe heartburn, that almost completely goes away. And there's polycystic ovarian syndrome, which is also associated with obesity, which is menstrual irregularities, infertility, hirsutism.
Yeah.
That also essentially goes away.
And it probably increases their lifespan too, doesn't it?
Incredibly. There's been a study actually that compared 8,000 patients that chose to have surgery and 8,000 patients that chose not to have surgery. These patients were followed for more than 10 years, and they found that there was a significant drop in mortality rate in the patients that chose to have surgery.
Well, you know, you've done a great job, and we're going to have some of your patients on our show coming up here real soon, and they're going to be the ones that are actually telling it like it is. And, you know, I'm glad we're doing this show, period.
Right, I look forward to it.
Okay, good. Well, we'll bring your guest on right now.
All right, thank you.
Thank you. Dr. Bobby, your next patient, Randy Burns, is an amazing story. Just ran a marathon, didn't you?
I did.
How long ago did you have this gastric bypass surgery?
13.5 months ago.
So you weighed how much 14 months ago?
I weighed 280 pounds.
Now, can you imagine yourself running a marathon at 280 pounds? Impossible, right?
Absolutely.
You would have probably died somewhere around the first 20 feet, right?
At least.
Today, you're a totally different person.
I am.
It's amazing. How did you find Dr. Bobby anyway?
I did some research on gastric bypass. I researched it for a couple of years. Since I was 14, I was either on a diet or planning a diet, and I tried everything. Absolutely. I always lost weight, and I always gained it back.
Yeah. Let me ask you this, Dr. Bobby. Does anybody really succeed on some sort of diet?
Studies have shown that you will lose weight with diet, but you are unable to keep it off for a long time.
Okay.
The difference between diet programs and actually having surgery for weight loss is with surgery you're able to lose the weight and keep it off.
Yes.
And that's the whole purpose, and this has been demonstrated with the multiple studies that have been done in the past, and including NIH studies that have confirmed this.
Okay, Randy, how has that changed your outlook in life? In other words, what did you think about yourself before, and what do you think about yourself today, and what are the things that you think you now can do which you couldn't do before?
I never had very much confidence. I always would go on these diets and I'd lose some weight and I'd be excited that I was going to be this new thin person, and then I'd hit a plateau, and that was it. I would not lose any more weight. I felt like I was spinning my wheels, and now I just feel like I have the tool to use to keep this weight off for the rest of my life.
What about health-wise? How has that improved?
It was pretty amazing. Within 3 months of the surgery, I was off my blood pressure medication. I used to have sleep apnea requiring a CPAP machine that I wore at night.
Okay.
I returned that to the company. I don't use that anymore. I feel amazing.
Gladly, huh?
Oh, absolutely. That thing was horrible to wear every night.
Was it difficult, Randy, to take that first step to come to see Dr. Bobby?
No, it really wasn't at all. Like I said, I'd researched it for a couple of years, and I'd read about Dr. Bobby. I was interested in meeting him, and I came in immediately. He made me feel comfortable.
Good.
Heard my story. He said I was a candidate for it, and we went from there.
Good. Well, you know something, I'm proud of you. I'm sure you're proud of yourself.
Thank you.
And Dr. Bobby's done a wonderful job with you, too. And we're going to have some of his other clients and patients on here. So thanks for coming here today.
All right, thank you.
Appreciate it.